The field of regenerative medicine is growing at a fast pace, and stem cell therapies and clinics are gaining popularity as a treatment of choice for many patients. As physicians, we need to educate our patients on the advantages and disadvantages of stem cell therapies and help them to make an informed decision. Currently, there exists a lot of confusion around stem cells and stem cell therapies, and we would like to clear up many of those confusions with a short educational video titled How to Protect Your Patients When They Inquire About Stem Cell Therapy, provided by Neomatrix Medical. After a short introduction, we'll briefly discuss the past, present, and future of stem cell research. Then we'll explore the 5 key questions your patients should ask when considering stem cell therapy and the 5 reasons not to use their own stem cells. We'll proceed by listing the conditions that have been successfully treated with stem cell therapy and conclude with a summary. If you decide to take a very brief multiple-choice questionnaire after watching this educational video, we'll provide you with a certificate of completion. Introduction. Regenerative medicine is a branch of translational research in tissue engineering and molecular biology, which deals with the process of replacing, engineering, and regenerating human cells, tissues, or organs to restore or establish normal function. Besides the definition of regenerative medicine, let's look at what regenerative medicine is today. Today, regenerative medicine is a game-changing area of therapeutics, offering a solution that enhances the body's own abilities to regenerate and replace damaged cells and tissue to restore normal function. Patients are able to receive various stem cell-based therapies at physician offices and stem cell clinics alike. The key is to understand your patient's needs and to identify the best therapy available. All stem cell-based therapies are not equal, and some of them pose unnecessary risk to the patient, lack research, or simply lack the results the patient is looking for. At the center of regenerative medicine are stem cells. Stem cells are important for living organisms for many reasons. In the 3 to 5-day-old embryo called a blastocyst, the inner cells give rise to the entire body of the organism, including all of the many specialized cell types and organs such as the heart, lungs, skin, sperm, eggs, and other tissues. In some adult tissues, such as bone marrow, muscle, and brain, discrete populations of adult stem cells generate replacements for cells that are lost through normal wear and tear, injury, or disease. Given their unique regenerative abilities, stem cells offer new potentials for treating diseases such as diabetes and heart disease. However, much work remains to be done in the laboratory and the clinic to further understand the best approach to cell-based therapies regarding certain disease processes, which is also referred to as regenerative or reparative medicine. Stem cells have the remarkable potential to develop into many different cell types in the body during early life and growth. In addition, in many tissues they serve as a sort of internal repair system, dividing essentially without limit to replenish other cells as long as the person or animal is still alive. When a stem cell divides, each new cell has the potential either to remain a stem cell or become another type of cell with a more specialized function, such as a muscle cell, a red blood cell, or a brain cell. Stem cells are distinguished from other cell types by 2 important characteristics. 1. They are unspecialized cells capable of renewing themselves through cell division, sometimes after long periods of inactivity. 2. Under certain physiologic or experimental conditions, they can be induced to become tissue or organ-specific cells with special functions. In some organs, such as the gut and bone marrow, stem cells regularly divide to repair and replace worn-out or damaged tissues. In other organs, however, such as the pancreas and the heart, stem cells only divide under special conditions. The current school of thought is that stem cells differentiate, but recent research is starting to challenge that belief. One of the main reasons is that mesenchymal stem cell differentiation, along with its straightforward mechanism of action, often does not explain the benefits seen with these stem cell therapies. Therefore, the answer to how mesenchymal stem cells exert their effects is still questioned. The traditional view that mesenchymal stem cells heal by maturing into replacement cells for damaged tissue is either partially or fully untrue. Research into the cell type now shows that the real authority of these cells comes from their ability to regulate the immune response and spark the body's own regenerative machinery. The main function may be the immune modulation along with the secretion of growth factors, cytokines, and exosomes. Contrary to common belief, research on stem cells is vast and growing at an incredible rate. Scientists agree that stem cells are the future of medicine. Let's take a look. Since 1996, the overall body of stem cell-related papers shows a relatively rapid and significant growth rate and citation impact on the medical and scientific community. Notably, at that point in history, 1996, stem cell research produced approximately 4,000 papers worldwide and represented 0.4% of global publication output. But by 2012, that figure had risen to over 20,000 in publications, greater than 1% of the total global output. Stem cell publications showed a growth rate of 7% from 2008 to 2012, which is twice as much as all global publication output on all medical and scientific topics. What lies behind us? Accomplishments. Stem cells have proven to possess long-term self-renewal ability that regenerate various cells, tissues, organs, and systems in the body by addressing the source of the dysfunction. Past advancements in stem cell research include successful treatment of muscular dystrophy, Alzheimer's, arteriosclerosis, diabetes, IBS, Parkinson's, RA, leukemia, and more. What lies before us? Research trends. Stem cells developing areas of research include developmental human biology, previously constrained by practical, moral, and ethical dilemma, especially the fields of cancer and the study of birth defects. Transplantation, as we seek means to create unlimited supplies of tissues and organs that restore function without immunosuppression and tissue matching. Gene therapy, genetic signaling aimed at prompting desired and necessary biochemical processes to achieve long-term expression and therapeutic effect. The immortal proliferative capacity of stem cells could overcome the problems of loss and insufficient expression of a gene, cell, tissue, organ, system, and eventually an entire human body, which gene therapy procedures currently face. Laboratory studies of stem cells enable scientists to learn about the cell's essential properties and what makes them different from specialized cell types. Scientists are already using stem cells in the laboratory to screen new drugs and develop modeling systems to study normal growth and identify the causes of birth defects. Research on stem cells continues to advance knowledge about how an organism develops from a single cell and how healthy cells replace damaged cells in adult organisms. Stem cell research is one of the most fascinating areas of contemporary biology, but as with many expanding fields of scientific inquiry, research on stem cells raises scientific questions as rapidly as it generates new discoveries. Next, we'll discuss the 5 key questions your patients should ask when considering stem cell therapy. This document is also available for print, so you can share this information with your patients. The 5 key questions are: 1. What is the source of the stem cells? 2. How many live mesenchymal stem cells does the end product contain per 1 milliliter or 1 cc? 3. Is the product in full compliance with Section 361 Human Cellular Tissues Products of the FDA? 4. How is the product delivered or injected? What type of imaging is used to deliver the product accurately to the damaged areas? 5. How many of these stem cell procedures has the physician performed thus far? And what is the success rate? Question 1. What is the source of the stem cells? All stem cells are not equal. Each source has its advantages and disadvantages. So let's explore these various sources. Broadly speaking, stem cells can be sourced 3 ways: allogenic from humans, autogenic from the patient him or herself, and xenogenic from animals. Xenogenic sources are not used in human applications. Allogenic sources include human placental tissue, umbilical cord blood or tissue, and embryonic tissue. Autogenic sources include harvesting from the patient's own bone marrow or adipose tissue. Next, we'll discuss the advantages and disadvantages of these various sources. During the President Bush era, from 2000 to 2008, the majority of stem cells were harvested from aborted fetal tissue. Besides the moral and ethical concerns with this type of stem cells, these embryonic stem cells cause teratomas or tumors in mice with laboratory testing. Therefore, the use of embryonic stem cells for human therapeutic applications always has been and still is illegal. Embryonic stem cells are only used in research. Many people dismiss the potential of stem cells in the future of medicine because they wrongly assume all stem cells come from the aborted fetus. Adult stem cells, usually derived from bone marrow or adipose tissue of the patient, have many disadvantages compared to mesenchymal stem cells derived from birth tissue, in particular the umbilical cord matrix, Wharton's jelly. In order to properly protect your patients from outdated procedures, disappointing results, and unnecessary pain and risk, let's dive into the 5 main reasons not to use the patient's own stem cells. Reason number 1, the amount or quantity of stem cells drastically declines in our body with age. Scientific research clearly shows that as we age, our body's ability to regenerate damaged tissue decreases. That's because the quantity and quality of the stem cells in our bodies begin to significantly diminish over time. In this graph, we can see that in a newborn, 1 out of 10,000 cells is a stem cell, and that number drastically declines with age. As a teenager, only 1 out of 100,000 cells is a stem cell. And when we're 50 or 60 years old, 1 out of 2 million cells is a stem cell. Reason number 2, the quality of stem cells in our body drastically declines with age. How do scientists explain that the quality of stem cells in our body drastically declines with age? Telomeres. Now, what are telomeres? Telomeres are the end caps that protect our chromosomes, and over time, telomeres shorten. And when they shorten, their ability to replicate and differentiate reduces, and eventually cell division stops. We already know that a stem cell is different from any other cell in our body because a stem cell has 2 cardinal properties. Number 1, a stem cell can replicate itself. It can make perfect copies of itself upon division. And number 2, a stem cell can differentiate into many different cell types in the body. Now, as we age, the quality or the ability to replicate and differentiate drastically declines. Providers of these outdated stem cell-based therapies know this and therefore amplify or multiply the low amount of stem cells obtained from the patient. But even with an ample amount of stem cells, the quality of these stem cells is still poor, and therefore their ability to repair tissue effectively is still impaired. The significant decline of the quality and quantity of stem cells in our body as we age is easily illustrated in the following real-life example. When a young child falls and cuts themselves, how long does that cut or wound take to heal? 24 to 48 hours, right? What if you fall and cut yourself? Indeed, several weeks or even longer. That's because the healing properties of the young child are at its peak. The young mesenchymal stem cells have a far greater and faster healing capacity than our aged body stem cells. So when we plan on repairing or regenerating damaged tissue in our elderly patients, would it make more sense to rely on their own stem cells, which are low in quantity and quality? Or would it make more sense to use stem cells from birth tissue, such as from the umbilical cord matrix, to get the repair job done? I guess you know the answer. The reason we recommend not to use your own stem cells is because the quantity and quality of the stem cells in our body drastically declines with age. Besides those 2 main reasons, there are more reasons. Reason number 3, the essential components for proper tissue engineering may be missing. For effective and consistent tissue repair, tissue renewal, and tissue engineering, the body needs more than stem cells. Stem cells need the support of 3 essential components in the body to get optimal and consistent results. Number 1, growth factors. Growth factors activate and stimulate the stem cells and put them to work. Number 2, bioactive molecules such as cytokines, HA, hyaluronic acid, and collagens, type 3, 4, etc. This is the brick and the mortar. These are the tools that the stem cells need to do the repair work. And number 3, scaffolding. Scaffolding is the structure or the framework from which the stem cells can rebuild, renew, and re-engineer connective tissue. Now, as you can see, stem cells are crucial, but without the other 3 essential components, the results of the stem cell therapy may be disappointing. When we source stem cells from your own body, for example from the bone marrow of your hip, and then relocate those stem cells to the injured area, for example your left arthritic knee, all we're doing is simply relocating your own stem cells, but we're really not adding anything of value to that treatment. So the essential components of the tissue engineering may be missing, such as your growth factors, your bioactive molecules, and your scaffolding. So the question becomes, why source your own stem cells? First of all, they're very low in quantity and quality, and second of all, the essential components for tissue engineering may be missing. Reason number 4 not to use your own stem cells: it requires a surgical intervention. Mostly, stem cells are obtained from your adipose tissue through liposuction, or stem cells are extracted from the bone marrow, usually the hip. Now, these two surgical interventions not only may be painful, but also pose an unnecessary risk to the patient, including bruising and possible infections, and increased liability to the healthcare professional. Reason number 5, stem cell-based therapies that use your own stem cells lack uniformity and quality control. Clinics and laboratories have been shut down for this reason. The adult stem cells are usually derived from bone marrow or fat cells of the patient, him or herself, which are extracted in one procedure, isolated, treated, and amplified, and then reinserted to the target pathological area through another interventional procedure. There exists a wide variety of methods by which the cells are isolated, treated, and amplified, and these methods can vary even from procedure to procedure within a single clinic. Most of these processes are proprietary, and many are protected by patent. As a result, there's no simple way to determine if a procedure or a particular application has any clinical validity. Much of the information available takes on an air of being anecdotal and resistant to investigation through rigorous scientific methods. Most, if not all, of the current clinical use of stem cells in the United States would fall under this rather inauspicious descriptor. Conclusion: we recommend you do not use your own stem cells, and here are the 5 main reasons. Number 1, the quantity or the amount of stem cells in your body drastically declines with age. Number 2, the quality of our stem cells in our body also drastically declines with age, which means that their ability to replicate and differentiate into specialized cell types drastically reduces. Number 3, the essential components for proper tissue engineering may be missing, including growth factors, bioactive molecules such as cytokines and HA, and scaffolding. Number 4, this use of adult stem cells requires an unnecessary surgical intervention, which increases the risk to the patient and the liability to the healthcare professional. And number 5, this procedure is not standardized, lacks uniformity, and there is no quality control. Quite frankly, the use of adult stem cells is outdated and is far inferior and has many disadvantages to the use of umbilical cord tissue. We've been talking about the different sources of stem cells and have established that 1, embryonic stem cells are illegal and not used in human applications, and 2, adult stem cells have many disadvantages, deliver inconsistent results, and pose an unnecessary risk to your patients. But we can also derive stem cells from birth tissue, either from the placenta or umbilical cord. Placental tissue products contain all the necessary components for tissue engineering, but currently no live mesenchymal stem cells can be verified in these products. Hematopoietic stem cells derived from umbilical cord blood are great in forming new blood cells, but are not fit for soft tissue engineering. The absolute best source of stem cells is the umbilical cord matrix, in particular the Wharton's jelly, which is the inner lining of the umbilical cord. This tissue contains not only a high quantity and high quality of live mesenchymal stem cells, but also contains the essential components for tissue engineering. Research clearly shows the benefits of umbilical cord Wharton's jelly mesenchymal stem cells versus mesenchymal stem cells from bone marrow or adipose tissue. Young stem cells from the umbilical cord matrix have a far greater fitness level and therefore are able to replicate at greater and faster rates, have a much greater and faster healing response, have a higher proliferative capacity, have a stronger inflammatory protective effect, and a strong migratory ability toward the site of inflammation, have a larger amount of different growth factors, especially BFGF20, have the ability to differentiate into adipogenic, osteogenic, chondrogenic, neurocells, and Schwann cells, help organize tendon collagen fibers and induce hepatocyte differentiation, have been shown to differentiate into nervous system cells, liver, pancreas, heart, and other organs of the body, are more robust. The range and level of specific cytokines is greater than those expressed by adult mesenchymal stem cells, sustain less damage from reactive oxygen species, ROS, retain telomere at the highest possible length, which protects them from premature loss of viability, continue to express molecules with immune-modulating activity after they're extracted from the umbilical cord and able to pass this ability to their progeny. This enables the infused donor cells, whether differentiated or not, to engraft into the diseased target organ and positively modify its microenvironment to promote repopulation. The infusion of immunomodulatory MSC provide a significant advantage by better overcoming host responses, providing the needed functional bridging action, and modifying the underlying pathological conditions at the basis of disease. Provoke little to no immune response when transplanted. Cell rejection is not an issue, and human leukocyte antigen HLA matching is not necessary, as with adult stem cells. Have immunomodulatory properties. Do not pose risk for metastasis of tumor cells, and in fact promote proteins that halt the cell cycle of cancer cells and promote tumor-suppressing genes. The first question regarding the source of stem cells has been clearly answered. Just remember that the younger the stem cells, the more powerful the stem cells. Question 2. How many live mesenchymal stem cells does the end product contain per 1 milliliter or 1 cc? Most companies or manufacturers do not have the financial resources to have their products tested by a third party, or they wish not to have them tested since the test results may be disappointing. Regardless, as a consumer, you must ask the exact amount of live mesenchymal stem cells that the end product, the product that you'll be injected with, contains for each 1 cc or 1 ml. Why? A product that lacks live mesenchymal stem cells or does not contain live cells will not produce the results you're looking for. You would be relying on the activity of dead tissue. So ask the provider this question and ask for proof of third-party verification. The average viable live MSC mesenchymal stem cells that are in our product ranges from 1 million to 1.2 million per 1 cc. Question 3. Is the product in full compliance with the FDA guidelines? As a consumer, it's important to ask about FDA compliance because more and more clinics are offering these stem cell-based therapies, and more stem cell clinics are popping up everywhere in an attempt to make a quick buck. As a result, many of them are cutting corners, and as a consumer, you do not want to be a patient at such a clinic. The FDA rightfully has closed down several clinics recently, mostly in California and Florida. The FDA regulates drugs different than stem cells products and dietary supplements, for example. One section is prescription drugs, and prescription drugs receive approval. However, stem cell products fall under Section 361, human cellular tissues and products. These products are not considered drugs and therefore do not receive FDA approval. So be on alert when a practitioner claims their stem cell product is FDA approved. That practitioner lacks knowledge, and his or her practice will be in trouble sooner than later. The FDA identified umbilical cord tissue as a structural tissue and states that structural tissue, in addition to cytokines and other factors, can and may have live cells present. The products we use align directly with the FDA homologous use definition for structural tissues. The product we use is fully compliant with all Section 361 regulations of the FDA. Now, where does umbilical cord tissue come from? All birth tissue products are obtained from C-section deliveries from normal, full-term pregnancies in U.S. donors that consent to the use of their birth tissues and are carefully screened prior to the use of their tissues in manufacturing our products. Comprehensive medical and social histories of the donors are obtained, and tissues are procured, processed, and tested in accordance with standards established by the AATB, American Association of Tissue Banks, and FDA requirements to minimize potential risks of disease transmission to recipients. Infectious disease testing is performed at a certified laboratory in accordance with the Clinical Laboratory Improvement Amendments of 1988 and 42 CFR Part 493. Each donor is tested for hepatitis B surface antigen, hepatitis B core antibody, hepatitis C antibody, antibody to human immunodeficiency virus types 1 and syphilis detection test, HIV nucleic acid test, and HCV nucleic acid test. All products are tested post-sterilization to demonstrate the absence of bacterial and fungal pathogens and are non-pyrogenic. Question 4. How do you inject the product? What type of imaging do you use to deliver the product accurately to the damaged areas? Unlike many practitioners who perform blind injections and don't use an imaging modality to accurately identify the damaged areas and place the product accordingly, at Neomatrix Medical, we use 100% safe imaging modality to optimize our results, MSK or musculoskeletal ultrasound. As part of your examination prior to your musculoskeletal or joint injection, a diagnostic musculoskeletal MSK ultrasound is performed to determine the current state of the injured area and to identify the specific location of injury. The ultrasound exam provides real-time imaging that can evaluate the health or injury of tendons, muscles, ligaments, bone, cartilage, and bursa. The use of high-quality musculoskeletal ultrasonography is considered a key part of the process, particularly considering that this modality plays a central role for clinicians to effectively hit the desired targets. Optimal placement correlates with earlier and improved outcomes, making it an essential component of our regenerative therapy applications at Neomatrix Medical. Question 5. How many procedures has the practitioner performed thus far, and what is his or her success rate? Patients should always ask about the practitioner's experience with stem cell-based therapies and inquire about the number of years they've practiced stem cell therapy and the number of patients that they've treated with their specific conditions and what their success rate is. Neomatrix Medical and Vitality Healthcare have performed tens of thousands of procedures in their clinics across the country over the past 4+ years. At Neomatrix Medical, we specialize in stem cell therapy, and stem cell therapy is the only service we offer. We treat patients with conditions that recent literature and published research, along with our vast experience, show to be responding very well to our pure Wharton's jelly mesenchymal stem cells. These conditions include neuropathies, a multitude of orthopedic conditions, and autoimmune disorders. There are no guarantees in medicine, period. However, our current success rate across our clinics nationwide is 94.4%. That's an extremely high success rate, which we contribute to our highly professional approach. What are the conditions treated with great success at Neomatrix Medical? Scientific research, recent literature, and our experience shows that the stem cells from the Wharton's jelly are beneficial in the repair of a wide variety of orthopedic and spinal conditions, including meniscus, ligament, cartilage, tendon, and rotator cuff tears, and the regeneration of any small and large joint in the body. We also have the ability to use these stem cells for neurological and autoimmune conditions. Research shows that they not only help with the repair of small diameter nerve fibers, such as in neuropathy, but also with the repair of large diameter nerve fibers, such as in radiculopathies and sciatica. We obtain good results with bulging and herniated disc and degenerative conditions of the spine. Patients with autoimmune conditions such as Parkinson's, MS, rheumatoid arthritis, lupus, etc. also respond well to these therapies. Fibromyalgia, COPD, and other lung conditions, eye conditions such as dry eyes and macular degeneration, and sport injuries respond very well to stem cell therapy. RED, or erectile dysfunction, and hair loss protocols are also effective. Key points. Regenerative medicine is a fast-growing field within medicine, and a vast amount of research continues to be produced. Scientists agree that stem cells are the medicine of the future. Not all sources of stem cells are equal. Although adult stem cells continue to be used, there are many disadvantages to the use of these low-quantity and low-quality stem cells from the aging body. Stem cells from birth tissue are far more powerful and effective for tissue repair and do not require a surgical intervention. Please protect your patients from healthcare professionals who may not be compliant with FDA regulations, cannot verify the number of live mesenchymal stem cells in their product, do not use safe imaging modality, or do not have adequate experience in providing these services. Upon completion of a very short multiple choice test, you will receive a certificate of completion.